Hey everybody, my name is Christian. I'm a certified podologist at Foot Solutions in Kitsilano, and today we want to talk about metatarsalgia, or ball of foot pain, which is something that we see very frequently in our practice. Metatarsalgia will present itself on the metatarsal heads, which make up the ball of the foot. The metatarsal shafts are the middle of the metatarsal bone, and then we also have the metatarsal base, which attaches to those metatarsal bones. That's where the metatarsal heads are located, where we tend to see the most amount of pressure. In many cases, it's the first and second metatarsal bone that create a lot of issues. When people pronate, overpronation being arch collapse, causing your foot to roll in, we see a lot of discomfort in and around those joints, usually a little bit less towards the other joints, although in some cases there may be callousing present in some of these areas that can put a lot of pressure on the foot. That callus may be due to the shoe being too narrow and the foot resting on an edge that's causing the callus to build up, or potentially because a lot of times, as you can see in this foot here, the toes are actually getting squished inward. What ends up happening, the wall of the shoe is causing pressure against your toes, causing those toes to go in, and then what happens is it almost has a supinatory, outward rolling type effect, where it loads more pressure on this metatarsal because now this toe is not taking away some of that load. There's different ways to treat this. Most of the time we're looking at arch support to try to redistribute the pressure across the bottom of the foot, so there's not as much pressure here. We're trying to load more pressure into the arches of the feet. In some cases you could put extra cushioning there, but cushioning isn't always the answer. I mean, cushioning is one way to reduce some of this pressure, but you may not necessarily get full pressure relief if the padding is causing more of a restriction in the shoe, and you end up with the shoe being tighter. Now all of a sudden you're creating potentially other problems like Morton's neuroma, which is a different type of ball of foot pain. It has nothing to do necessarily with pressure, but it is more to do with the squeezing of these bone structures, causing the nerves that run in between those bones to get squeezed, and as a result you end up with a potential nerve discomfort that causes either numbness in your toes, it may cause a shooting pain in your toes, you may end up with a tingling sensation in those areas, and again, that's something different that we're not going to discuss in this video, so check out our Morton's neuroma video to learn more. In the end, what we're trying to do here is take some of the pressures off. If there's a callus that needs to be accommodated, we try to do cutouts for those to reduce pressure on those areas, and you can even trim away a little bit off your insole inside your shoes currently to take some of that pressure off and relieve some of that discomfort on callus areas. And those calluses can present themselves in different areas because in some cases due to foot injury, some of these metatarsal heads right here may have dropped, causing them to hit the ground first, and then you end up with more pressure and discomfort on that particular area, which needs to be offloaded. In some cases, you may even want to consider a chiropractic adjustment to make sure that the bones are all in their appropriate structure. The other thing you can also consider is adding a metatarsal pad behind the ball of your foot to reduce pressure on those areas. Now, if you have any questions regarding metatarsalgia, or there's anything you'd like us to answer that we haven't covered in this video, please don't hesitate to post those questions and comments below. Otherwise, have an awesome day.